All right, good afternoon, Corpus Christi. We're here with Rolando Barrera or Roland Barrera, and he's running for state representative. And right now, he's currently your Corpus Christi City Councilman. Roland, thank you for joining us today and allowing us to interview you.
Yes, sir.
And so we'll start off and get straight to the questions here. What made you, as a city councilman, run as a state representative?
Well, I think it's a natural transition. For the last 25 years, I've been engaged in things that affect the legislature, not only the city council. I'm in the employee benefits business, where we provide, health insurance, and that's really been a component that I've been engaged in with regard to providing people with access to care. As a broker or an agent, typically we represent the members or the buyer, and so that way we have issues that we're in the rural areas, like let's say, for example, City of Mathis is a client of ours, City of Sinton is a client of ours, and they have difficulty. You have a blue collar worker, then they've got to basically go, they've got to basically, they've got to come to Corpus to be able to seek care. They miss time out. So we've worked with that, helping people get claims paid. I'm also a small business owner. So, years ago, I got involved with the Hispanic Chamber, worked my way up to the chairman of the Texas Association of Mexican American Chambers of Commerce. So I've worked with issues related to a fair procurement, basically programs that are to try to engage small minority businesses, to try and give them opportunities. So I've testified at the legislature numerous times on the health insurance side. I testified before the legislature with regard to a program, HB 2015, that created more transparency for insurance companies that allowed us to be able to lower insurance premiums for individuals. I've been engaged from that component. I was on the board of the Children's Advocacy Center for the Coastal Bend. And in fact, we worked with Chairman Herrero years ago to try and expand the funding for the region that we have here, expanded outside Nueces County. And that's a program that provides support to children that have been victims of physical abuse, sexual abuse, witnesses to violent crime. As many people know, I served on the RTA board for 8 years. I was chairman for 2. Went before the legislature here in Austin and in Washington with issues regarding public transportation. And since I've been on the council the last 6 years, every session I've had to go to the legislature to testify on behalf of our community on issues that are facing, city issues that we're facing. Here recently, obviously, there's been a lot of contention with regard to water. I had to work with, obviously, the Texas Water Development Board, TCEQ. So there's been a lot of issues that I've worked on that are related to our community that affect our citizens that I've had to go work at the Capitol to advocate for us. Affordable housing, we've probably procured the most amount of dollars for affordable housing programs here in District 3 than any other district, to be able to provide affordable programs so that way individuals can have an affordable place to live and a place with dignity. So there's those things that we've been working on that I think it's just being a state representative that candidly I think I have more experience than my opponent, who was actually in the legislature 14 years ago. And so I think that's one of the things that basically separates me, is that that opportunity has come and gone. And I think in the time that I've been outside the legislature, I've been more effective. My opponent had the opportunity, and obviously didn't accomplish very much. And so I think right now, and then in the last 14 years, has been absent. And then during that time, city issues also. With the city, we funded programs with regard to the Wildlife Rescue Center for the Texas State Aquarium. We funded programs with Texas A&M University with regard to the drone program. So I think in these last 20 years of consistent community support, experience that understands the legislative process, it only made sense that for me that when Chairman Herrero decided that he wasn't going to run, that it only made sense for me to go ahead and take us to the next step where I'd offer that value, because I've dealt with a lot of problems the community's had, and I think being well-rounded is something that's important.
You basically answered all my questions, but we'll get a little bit more into depth about about this race. So you're running against Salimon Ortiz in the Democratic Party, and right now you're a city councilman, and he's a former state representative in that area.
Yeah.
And it's been about, I think it's what,
14 years.
14 years since he served, and you're stating that your proven track record, right,
Yes, sir.
as a leader here in South Texas. What do you think this race is going to determine if you were to win? What is that going to do for the constituents that are going to vote for you here?
Yeah.
So,
Well, I think there's some very important issues that I think that are facing our community, and one that I spoke of was access to health care. What is it? That's the thing. I've actually worked with independent third-party administrators to write contracts with hospitals, so that way we can ensure that individuals have access to care, those employees. Right now, Medicare, which is the accreditation process, is very difficult. And not Medicare, Medicaid, I'm sorry. The accreditation process for Medicaid is very difficult. And doctors are only getting paid 65% of what Medicare pays. And typically insurance pays 200 to 250% of Medicare. So you have a doctor that's right out of medical school, and where is it that they're going to utilize their, in order for them to run their business, which patients is it that they're going to take? And here in Texas, who has one of the highest uninsured rates in the nation, we need to ensure that people have access to health care. And some things that we could do is that we should incent, just like right now, let's say for example here in the Coastal Bend, there's economic incentives for manufacturing, whether it be Exxon, whether it be a plastics firm, whether it be hydrogen. But we need, if we did an economic development study, if we had another cardiologist here, because that's all insurance money, that's all Medicare money. If all that money comes in, how many people will we employ? And then at the same time, we're giving people access to the care that they need. Some of the challenges that we have here in the Coastal Bend, we only have 2 dermatologists. And people think the first thing they think of is vanity. But if you've got skin cancer, it's going to take 6 months to be able to get in to see one of those physicians. So then you have to go to San Antonio, or you have to go to Houston. And once again, the individuals that are blue collar workers, they've got to take the time to find that type of physician, to find that dermatologist, and then they're going to have to travel to some place like San Antonio if they've got some issue with regard to like skin cancer. So those are issues that I've been working on. You look like you want to ask me another question.
Yeah, I do. So I looked at your website before I came here. I know that you wanted to expand the workforce or expand the economy.
Yeah.
Can you elaborate and clarify what you mean by that?
Well, I think that's the other thing too. Being a small business owner myself and understanding, one of the things that we've been blessed with here in Corpus Christi is, I know people are still going through hard times, but you know what? Wages are higher than they've ever been. Unemployment is in the lowest that it's ever been here in the Coastal Bend. And a lot of it has been basically, that we've been a business-friendly environment. And so, right now, you hear of people, when I go in and meet new people with the new jobs that we're creating, whether it be for drone technology, whether it be for working at the plastics plant, whatever the situation may be, those individuals now are coming from out of town. And you have students that have left that are now coming back to Corpus Christi. So there's 4 basic things that you need to be able to expand the economy. One is transportation. We obviously are blessed here with the Port of Corpus Christi. The other one is having power. We've got a lot of infrastructure, not only in Nueces County, in the western part of the county, where we need jobs. Obviously, there's opportunities there that are in the western part of the county. One of the good things that's coming up is obviously the Tesla battery plant. So it's going to be much needed jobs, and they're not going to be minimum wage jobs. So those are the things. We have access to electricity to be able to provide that. We're going to have access to water. I've been at the forefront of this desalination initiative to be able to move forward so we can provide water. Because as we want to expand the industry, if we want to expand these jobs, we're going to need that water. So, and then you need human resources. We need an educated workforce. So from the state basically is what funds the universities and Del Mar College. So if we can continue to expand on that job training that we can do here to have an educated workforce. So we've got to have training. So we need human resources. We've got transportation here. We're working on the access to water and the electricity. The opportunity is here. So those components, the legislature has to work with the local community so that way we have that opportunity to expand.
If you were to be elected, what would be the first bill you introduce first day?
Well, I guess the thing is one of the things that, like I said, is near and dear to my heart is access to health care. As I've said before, some of the things is that could be done is these economic incentives, once again, for physicians to want to practice, whether they have, let's say, for example, improving the funding with regard to Medicaid is one component. And the other one is that way when we have these rural areas, let's say for example, whether it be Robstown, Bishop, Driscoll, Agua Dulce, to be able to have satellite offices, that there's incentives for these doctors to be able to provide access to those patients there. So that way you don't have an individual that works out there and then has to drive all the way to Corpus Christi or to San Antonio or whatever the case is. So I think those are some initiatives that could be done, is to provide these, to expand on economic incentives so that way we can have access to health care. And some of it may be simple as providing incentives for doctors to help pay for the cost of their education and pay for some of their student loan debt.
Well, it's kind of been like that here in the state of Texas, because I think Texas is number one in uninsured people. And with, a lot of people believe here in Texas, they play political football like the way they do with the immigration or the border issue, in the Valley.
Yeah.
So how are you going to get this done if, with Republicans in the state representatives area? How will you be able to work with Republicans and Democrats and everybody or a lot of different diversified, interested people?
Well, I would say yes. I would say yes because number one, let me tell you. I've already worked on legislation. I worked on legislation with a Republican majority to be able to require insurance companies to be more transparent so that way we can reduce insurance premiums. Because everybody agrees that health insurance premiums are too high, and we've got to be able to manage that so that way carriers or other competitive companies can come in and underwrite to help reduce those insurance premiums. The other thing that I've worked on is I actually worked with not only Abel's office, but with back then Lieutenant Governor David Dewhurst to be able to expand the funding for the Children's Advocacy Center here in Corpus Christi, as I said, to make it the Coastal Bend Children's Advocacy Center in Corpus Christi. So I've already worked on those initiatives and I've already built those relationships.
Well, we have the Affordable Care Act, and so how would you differentiate the Affordable Care Act on what it's already doing here in the state of Texas?
I think the thing is that the challenge with the Affordable Care Act is what's been done is that they're requiring insurance companies to be able to meet certain mandates. And so sometimes there's unintended consequences with that. Okay. Now, what my thing is that, and I look at it, and this is one reason why I feel that it would be more supported by Republicans or by the more conservatives, so to speak.
Right.
Is if we look at it from an economic development standpoint, that we're able to bring cardiologists to Corpus Christi, we're able to bring neurologists to Corpus Christi. And once again, if let's say, for example, there's some sort of bill that says that it is able to incent these individuals so that way they can go and practice in the areas that they're not, and ask them to work through that, to work through satellite offices so we can find those individuals. And so what does that do? Doctors employ people. What is it? They provide benefits. They provide competitive benefits. So they would also be providing good paying jobs. In the meantime, we're going to have healthier individuals because now they're going to be able to go, they're going to be able to have that access to care. When I talked about earlier about the expansion of the funding for the Coastal Bend Children's Advocacy Center, the statement that I made basically is when we talked to conservatives in the legislature was that this is also an economic development issue. Because once again, we have to stop the cycle of abuse. So what happens is if you have an individual, and maybe they're from the inner city, and they've been a victim of whether it be physical abuse or sexual abuse, chances are they don't get the help they need, and then they self-medicate. They self-medicate, whether it be through drugs or alcohol. They get into trouble, or they may commit a crime to be able to get access to those drugs. It crowds up our jails even more for people that are incarcerated. And then from this standpoint, and then it takes police officers off the street because they've got to deal with these issues. So this way, if we go ahead and we work to be able to start the healing for those children at that time, it's an economic development issue. Back when Raul Torres, who replaced my opponent, he basically said, well, what is it that you do that Child Protective Services doesn't do? And I said, this is a completely different program, and look at it from the economic impact of not doing anything. How can we improve on that? And with Abel Herrera's help, Republican Lieutenant Governor David Dewhurst was one of the ones that led the charge.
Okay. Another state issue, real quick, and this is just the cherry on top. I guess. What are your thoughts and opinions on state gambling for the state of Texas?
Well, I do feel that number one, it needs to be regulated. I do support casino gambling here in the state of Texas, and for a couple of reasons. Number one, you see people going to Louisiana, you see them going to Oklahoma because of to have these resort style places. And unfortunately, we do have gambling already here in the Coastal Bend. All these game rooms that popped out. I think the last time that I got a report from the police department that there was almost 100 game rooms here in Nueces County. Now they've been able to crack down on them, but the thing is that there needs to be a regulatory agency that's very specific, that allows specific rules, so that way we can combat these and they can be prosecuted. So if we have an organized system, a regulatory system, and I think Corpus Christi would be a great place for a casino. Galveston would be a great place for a casino. Right. So I think, yes, I support that.
All right. I guess one last one real quick. 1 minute. Thoughts on marijuana legalization?
Well, I think, number one, that's a good question. And what is it? I think sometimes that we need to look at some issues that were in regard to victimless crimes. I think that if we have these dispensaries that are available, and that we're able to once again capture the revenue, and we have the same laws in place that we have with regard to people that are driving under the influence, or people that either working under the influence. It's another component. And plus, we need to expand the medicinal properties of it, because there are individuals people that have cancer, and that there's treatment of which they need, and it's just still an onerous process.
That's Roland Barrera. He's running for state representative, District 34. Right now, currently holding office for the City Council District 3 position. I want to wish you the best on your campaign trail, and thank you for stopping and talking with us.
All right, my pleasure.
Yes,
Thanks.
sir.